We're going to go over some releases for your lower back coming from the front. We're going to work some rectus abdominis muscles, some iliopsoas, iliacus, different muscles that contribute to lower back pain. A lot of people who have lower back pain, and Ashlyn's our photographer. She can come closer, make sure you can see what I'm doing. So the first thing I'm going to do, like I said, I was about to say, a lot of people with lower back pain, it can actually come from a weak core, which causes us to kind of start slouching and pulling on those ligaments in our spine. The iliopsoas muscle runs through here, but comes up and under all those fun organs and into the inner lower spine. But what can happen is it'll pull when it gets real tight on that lower spine. So no, we're not going to hit that part because we have to push through a bunch of fun organs, but we're going to hit some of the trigger points for it that will help release the entire muscle. But first we're going to do is just a little bit of a circulation work, plus Miss Sydney, our therapist here, wanted some ab work. So when I do some of this, it's good to follow that pelvic bone right through here, kind of run under. You can get under some of the QL muscle, try to reach around, get some lower back. For someone that wanted all this, it's pretty tender on you, isn't it?
Usually always is.
Yeah. It's one of those feels great after type things. So just a little pull, depending on the person, if you can reach, get closer to their spine. And a lot of times, at least for me, when I'm working on this, you'll start to feel a little bit more movement, and it can help their digestive tract too. So if they have digestion issues, this will help as well. Now you want to go clockwise. I'm going to come over here on the other side and do a little bit of the same. Yeah, believe it or not, if you have a lot of digestion issues, it can cause lower back pain too. A lot of those nerves wrap around. How's all this feeling, Sydney?
Amazing.
See, a lot of people don't think of abdomen massage, but it does help a lot.
I encourage those to at least try it once if they haven't before. It's one of those things you don't think about, but then when you actually get it, you're like, I need this.
All right, so we got some of that. Next thing, Deanne, we're going to get into some psoas release. Part she's been waiting for. I'm just going to put her up here for a minute. So when it comes to releasing some of the psoas, here's the pelvic bone right through here. I don't know if you can see, Ashlyn. Here's the bone. Right where the top of it is.
Come to your side then. Not very graceful.
So guide your way to the top, feel your way around. Once you get to the top, you kind of reach down and grip and pull out a little bit and then lean straight down. And sometimes if you want to just release it by just sitting here for a minute, it'll release. If it's being a little bit more stubborn, you can do a more passive release approach where I would actually bend her knee up. So go ahead and bring your knee up. I'm going to hold that pressure and I'm going to come up. And I go in, out, in, out. And we'll go down. The other way is if I wanted to press in there, I can have them lift up. So go ahead and lift up. So you're going to want to do that through here. Now, like I said, the top of the bone's here. You're going to work your way a little bit further down, midway through the bone right there. Find that muscle, sink straight down. I don't want to torture her, so we're not going to have her do it this time, but this kind of just shows you the hand placement. So just make sure, Ashlyn, you can see where we're at. A little tender in there.
Not too bad.
Not too bad. All right. And then work your way down to a little bit lower. A little bit more tender there. And relax. And it's already getting a little softer. I don't know if you can tell, but
I can a little bit.
another spot I like to get, it's not the psoas, but think of the belly button, go down about an inch and then over about an inch. You'll find a little tight band right there in the rectus abdominis. And I'll usually do the same thing, have them lift up and down. But good releases. All right, what next we're going to do is Sydney, if you'll lay on your right side.
Okay.
All right, we'll bend your knees up, both of them. There we go. In general, I'll put a pillow under their head, but for the sake of this video, we're going to bring this arm up. There we go. All right. Yeah. So, you got all your QL muscle through here, your obliques, all contribute as well. So we want to guide our hands along that. Make sure you can see my hand placement. If they say oofta, doing good. And you can even kind of do a pulling motion through the front. So kind of lean forward and pull some of that tension out of there. Like I said, this is one of those things that are going to feel great later. And then as I'm going here, I'll put my hand on my thumb and kind of go straight through their lower back. Next, what I like to do. So we're going to get this into a full stretch up here. Now you're going to want to put your forearm along on top of the bone right here, but you're going to want to try to sink under the bone. So we're going to roll under here. Tell them to take deep breaths, as deep as they can. Just let it release. It should start to get less tender. All right, now I'm going to guide my way down towards the lower back. And relax. All right. Next thing, Ashlyn, if you want to come on this side of me.
Okay.
You'll have the bone right through here. You want to get right on top of that. Just lean straight down. Those pressure points. If I want to do an active release, I would have her bring her knee off of the other knee. So go ahead and bring your knee up. And go down. As you get lower, you can get into that piriformis, that biker muscle. And relax. Last but not least for this, we're going to do a little hip flexor stretch. So, so I like to come under, grip the knee, push into that piriformis when you do this. Lean back, feeling that.
Mm-hmm.
I'm gonna lean back.
Lovely.
And then you want to have them learn the movement, their brain, to teach it, to release. So go ahead and resist that movement a little. So push against me. There you go. And relax. And again. Relax. All right, feeling better?
Mm-hmm.
All right, these are some lower back releases. Hope y'all enjoyed them. Try them out and comment below what you think. And thanks for watching. Please hit subscribe and like our video. Thank you.